all.
We are concluding our month-long quest to raise awareness for Heart Health Month, and this February by talking about minimally invasive cardiac surgery. And joining us today is Dr. Stephen Bakir, a board-certified interventional cardiologist with Baptist Health and Cardiovascular Associates. I got that title right, didn't I?
Yeah, great job.
So, we say minimally invasive cardiovascular procedures. What does that all mean, really?
Well, it's a broad term for a lot of different type procedures that we do, and as you alluded to, there's a large spectrum. Minimally invasive can mean we're doing a procedure with a small puncture in the wrist,
okay,
which takes 15-20 minutes, and the patient goes home after a couple of hours. Minimally invasive can mean a true open heart surgery where the patient gets a couple of port accesses to the chest. The surgeon is operating via a robot approach, and but the patient's in the hospital for several days. They just don't come home with the proverbial zipper. So there's a large spectrum of minimally invasive, and of course the old adage is minimally invasive is something that's being done to you,
right,
not to me.
The benefits then are just the smaller scarring, or what?
So in between those are ways to approach heart valve problems,
okay,
congenital heart problems, atrial fibrillation, by doing things from inside the blood vessels. So it's not just the scarring, but the recovery. Oftentimes we can do a heart valve replacement without putting the patient on the heart-lung machine,
okay,
without putting the patient on a ventilator. So the recovery and therefore the risks of ventilator-associated complications, wound infections is much lower, and the patient is able to get back to their life with oftentimes, most times, a full recovery and get back to their life much quicker than with the traditional open chest approach.
Now, these are extensive procedures, though. It's not something that it takes a long time. These are delicate type procedures, are they not?
So to continue on talking with heart valve procedures, such
okay,
as where we replace an aortic valve or where we repair a mitral or a tricuspid valve. Those procedures involve a lot of people. We're doing them in a pretty slick room called a hybrid operating room, which is a cath lab and an operating room all in one.
Right.
We've got lots of support, and it looks just like an operating room because it really is, but we're not having to go through the trouble of opening the chest or the invasive nature of opening the chest. So it's a big deal. Often the recovery is a big part of it, but usually we're able to treat the patients and have a lower risk of problems.
Right, and recovery is quicker.
Correct.
That sounds good. All right, well, that was fantastic information right there. Say it one more time, what these procedures are?
Well, this is a broad term for minimally invasive cardiac procedures.
I wanted to see if he knew exactly what we were talking about, and he does. Dr. Stephen Bakir, wonderful job. Way to describe it to us as well. We're going to be describing you with plenty of new information on stories the next half hour as you watch WBRC 6 News at noon.
Thank you.
I'm Altima Morgan of Morgan.